for the opportunity to be here today. I want to start by acknowledging someone really special in the room, and that's Dr. Charles Carpenter, who I see seated quietly in the back row. But he has really led the charge in the fight against AIDS in this state for the last 25 years. And he's a mentor to pretty much everyone who has made a difference in the fight against HIV in Rhode Island. He was also willing, at a time where it was considered very provocative and controversial, started taking care of people in the correctional system and then started training people to do that, and has since gone on to lead one of the nation's leading centers for HIV/AIDS research. He's one of my mentors. He's also mentored a lot of other people in the room, including my partner in crime, Phillip Chan. And also I see a lot of other people who've been doing work in this state a lot longer than I have around the room. Paul Liberty, Paul Fitzgerald, Phillip Chan, Anthony, and I apologize in advance if I've missed other people around the room. So today I want to stir the pot. Those of you who know me know that I don't stray away from controversy, and I think it's important to talk about who's getting newly infected in this state and what we need to do about it. This morning, Mike Fine called me on my cell phone and wanted to make sure that I knew exactly how many people have been infected this year, and he also reminded me that even though in the last few years there have been declines in HIV infections, this year there's been an increase of 17.5%. This isn't something that we've heard a lot about, so I want to bring it to everyone's attention and sound the alarm bells. I also want to really commend Dr. Fine for his efforts to take this on in a big way. I don't know of any other director of any other health department in the country who's really committed to getting new infections down to zero. We might be the only state in the union where this is actually possible. I think that that is something that we should really think about. We have really decreased new infections down to below 100, I think, over the last couple of years, which is remarkable by any measure. A lot of that is due to the work that has been done in the correctional system and the willingness of people like Dr. Carpenter, Dr. Flanagan, and Dr. Jody Rich, who take care of people inside the correctional system and also when they are released. This is a remarkable public health achievement, and it's one of the reasons that we have had declines in HIV infection over the last decade in Rhode Island. But I think one thing that's really important to remember is who's getting infected today and what it means about advocacy. Today, over half of the new infections are among men in Rhode Island, and we know from Dr. Phillip Chan's study that a lot of these people are meeting online on the internet. The problem is our prevention response hasn't been as quick as those websites that are making money hand over fist and helping people hook up online. So we really have to get our prevention response aligned with how people are becoming infected. It's important, though, that when we do this and respond to this crisis, it can't be in a way that further promotes stigma among men who have sex with men. We know from the 1980s that that absolutely didn't work. So it's time that we really have to rethink our prevention strategies and think about how we get prevention messages out on the internet in really effective ways. This might mean that we need to partner with a lot of those online web companies. I would posit that they do a much better job of reaching the highest risk people than we have done in the public health community, and it's time for a revolution and to really think about how we can work with them. We know now that people who are on antiretroviral treatment can live long, healthy lives. We also know that people who know their HIV status tend to reduce their risk-taking behaviors. All treatment starts with testing, so we really need to be working with these online companies to promote testing and treatment, and also our new prevention technologies like pre-exposure prophylaxis. Dr. Phillip Chan leads the only PrEP implementation program in the state of Rhode Island, and it's considered a national model by any measure. We need to be promoting that clinic pre-exposure prophylaxis, which is 1 pill once a day, which people who are at high risk for transmitting HIV can take to reduce the chances that they acquire HIV. Why aren't we hearing more about this? We ought to be promoting this at every possible opportunity with online and digital media outreach campaigns. And I would challenge all of us in this room to get involved in this way. We would really like to work with the Prevention Coalition on this kind of initiative. And this will also involve talking to people that use the websites. I downloaded a lot of these to my cell phone because I didn't really know how to use Grindr. You know, you end up in public health, you have to step out of your comfort zone a little bit and understand the technologies that people are using. I remember my husband looking at my phone saying, "What is this?" But these are the kinds of things that we need to do. So I would like to challenge everyone in the room that we really need to think about how we can enhance our prevention strategies by working with these companies online and also shaming them into corporate social responsibility. Why aren't they doing more? If Coke and Pepsi and Philip Morris and all the other naughty multinational companies are pouring money into corporate social responsibility programs, we ought to be demanding that they do that as well. So stay tuned for my next advocacy campaign. The other, thank you. That's my brother. He's plant. The other thing that I think we really should think about is routine HIV screening. Since 2006, the Centers for Disease Control and Prevention have recommended that all Americans between the ages of 13 and 65 get screened for HIV once a year. This is not happening. This is not happening around the country, and it's not happening in Rhode Island. We should be working with federally qualified health centers in this state, as well as primary care practices, to start implementing routine screening policies. That means that everyone who walks through the door for any primary care visit, obstetric visit, family planning visit, or wellness visit should be offered an HIV screening as part of their routine clinical care, along with their weight, their cholesterol, and all the other vital signs that we take. These are the two things that I hope that you remember from my speech today. One, that we should be working with online website companies and that we should be shaming them into corporate social responsibility. And two, that we should be screening people for HIV routinely at all of our primary health care centers. I think if we were actually able to execute those two action steps, we could address the state's rising rates of HIV infection. We would have a good chance of getting down to zero, especially with all of the servants that we see in this room who serve the public who are at risk for HIV, and a visionary leader like Michael Fine, who's willing to make a bold statement about getting down to zero. So I'll leave you with that today, and thank you very much for this opportunity.